Okay, this is a variation of a Spanish squat. So a lot of people use Spanish squats for when people are having tendon pain in the front of their knee. It's a really good way to get an isometric hold that's going to kind of help get some blood flow to the area, help warm up the knees, but also just help the knees feel a little bit better. So this is kind of a spin-off on that. We're actually going to be doing some active Spanish squats, so up and down. And what we're trying to really focus on is shifting our center of mass backwards. So weightlifters tend to do a lot of overhead work. They can be very compressed through the back of their body. And then what happens as a result is they're not very good at shifting their weight back. So they might have issues with staying on their heels in the dip, or being able to get overhead range because they're super compressed through their upper back and mid back. They also might have issues with trying to hinge their squat, or really relying on their lower back to be the main mover because they can't control their pelvis as well as they need to, because their pelvis is always trying to move forward. So this one's a really good one to think about, really sitting back in the squat and trying to almost shift into the back of your foot a little bit more. So when you're doing it, I want you to be really aware of that. Now, it takes a little bit of setting up, okay? So you need a big, thick band. Depending on the thickness of the band is going to make things a little bit more challenging. You also are going to need an anchor. So you're popping the band around the anchor, and then from there, you're popping the band around the back of your knee. So from here, you're going to take your squat stance, and you can see straight away the band's trying to pull me forward. So from this position, I'm then going to grab my load, and I'm going to hold it in a bit of a goblet hold, so out in front of me. So what I'm trying to do straight away is think about shifting back. So you can see, if I'm being pulled here, straight away I'm shifting back, then I'm going to come down into my squat. So I'm sitting back as much as I can tolerate and stand. So play around with your stance, but generally it needs to be the same kind of stance that you would normally squat in. And you're going to use that weight plus the band to counterbalance you and allow you to shift back, okay? So working really hard, essentially, to sit back, get nice and deep, and stand all the way up. So with these, heavy tension on the band is going to be helpful to help you shift back, but also a heavy dumbbell or kettlebell, even a plate in that goblet hold to enable you to do this with your rib cage, or retract your rib cage, so that we can open up those overhead movements a little bit more.